Hello everyone, my name is Kawabata from Japan. I am very happy to have this opportunity to make a presentation here today. It is also very encouraging that we can learn together at the conference in Russia from Japan, even though it is online under this severe situation of COVID-19. Well, my presentation is relationship between social withdrawal and aggression in university students. First of all, do you know Hikikomori? Hikikomori is Japanese word meaning social withdrawal. Social withdrawal is a major health problem that is becoming increasingly important in the last year. It was first described in Japan as Hikikomori syndrome. Definition: a person who had been withdrawn from home for 6 months or more without going to work or school, and with little or no interaction with people outside the family. This is the definition of Ministry of Health, Labor and Welfare in Japan. History of social withdrawal. In Japan, social withdrawal has rapidly become a social problem since the late 1990s. The concept of social withdrawal was initially used synonymously with truancy, but due to the aging and prolonged duration of the patient, it had been redefined as a problematic phenomenon separate from truancy. In the 2000s, the problem of social withdrawal was included in the problem of need, not in education, employment, or training, and was redefined to as a labor policy and employment issue. In this trend, social withdrawal had come to be seen as a lack or disorder of motivation and communication skills for social participants. In 2019, the Japanese Cabinet Office estimates that there will be approximately 540,000 socially withdrawal persons under the age of 40 and 610,000 over the age of 40. It's a very huge number. The affinity for social withdrawal. It is also expected that there will be many youth, including university students, who, even if they are not actually socially withdrawn now, have psychological characteristics similar to those of who are withdrawn and who show an affinity for withdrawal. So, it is very important that youth with an affinity for withdrawal are supported before they actually become withdrawn. Yeah, truancy, social withdrawal is one of a big problem in Japanese university. So it is very important to find such a student before they really become withdrawn and interact and support them. It is very important. The spread of withdrawal to the world. Hikikomori-like cases have recently been reported in many countries of varying socio-cultural and economic background, such as Hong Kong, Oman, and Spain. And Teo et al. Have revealed the existence of hikikomori in India, South Korea, and the US. So now we can see hikikomori all over the world, from Japan to all over the world. I found some papers dealing with hikikomori in Russia too. As following, Borisova and Moronova wrote the paper, Emotional and Social Loneliness as the Premise of Hikikomori Syndrome among the IST students of the St. Petersburg Mining University. And Voiskonsky and Soldatova wrote Epidemic of Loneliness in a Digital Society, Hikikomori as a cultural and psychological phenomenon. Well, now, psychological factors of social withdrawal. The following psychological factors have been identified as contributing to withdrawal. Difficulty in maintaining interpersonal contact, or sensitivity to the opinion of others, feelings of self-denial, and insecurity, tendency to isolate oneself. Aggression and social withdrawal. Aggression is defined as deliberately causing harm on others. So, generally, aggression is seen as destructive and negative. It has to be suppressed and prohibited by society. However, we, in clinical and educational practice field, it is often observed that aggression can be a force for breaking the status quo and overcoming obstacles. We sometimes get angry and attack something which is an obstacle for us to we complete our goals. So we attack that obstacle and break it, and we overcome the problem. In that case, aggression is an important power. From this point, we saw that aggression could be constructive and positive. In some cases, not every time. We believe that aggression can be divided into constructive, positive aggression and destructive, negative aggression. We believe both are the tail and front of the coin. This position leads us to hypothesis that this position leads us to hypothesize that the over-suppression of constructive aggression may deprive people of the motivation to confront their problem and in turn cause them to withdraw. Yeah, because to prohibit, to attack the obstacle, people tend to be withdrawn in their own small world. It is Hikikomori, social withdrawal. Hypothesis. We hypothesize that expressing aggression would reduce the affinity for social withdrawal. Method. We conducted research. This is our method. Participant, 185 university students, 83 male and 102 female were participants. Material, birth period aggression questionnaire was conducted. This scale measured hostility, anger, physical aggression, and verbal aggression. And we also used emotion regulation questionnaire. This scale consists of reappraisal and suppression, two kinds of emotion regulation. And we also conducted questions asking about the image of aggression, the image of aggression about goodness, effectiveness, and be praised. A question about the affinity for Hikikomori was also conducted. Procedure. We conducted a questionnaire consisting of the psychological scales mentioned above to university students. Result. All statics analysis were performed using SPSS for Windows. And at first, gender differences were found for a number of factors. Now let's see this. Almost all of factors showed gender differences. Anger, verbal aggression, reappraisal, suppression, image of the aggression, goodness, effectiveness, being praised, and affinity for social withdrawal. Most of factors show gender differences. So we have therefore conducted our subsequent analysis separately for men and women. We conducted multiple regression analysis separately by gender. Table 2 and Table 3 showed the result. Table 2 showed separate multiple regression analysis to determine the amount of variance in the affinity for social withdrawal in male students. Let's see, the two factors, image of the aggression, effectiveness, and anger decreased social withdrawal in male students. Table 3 is the result in female students. In female students, only one factor, hostility, decreased the affinity for social withdrawal. So for both male and female student, aggression decreased the affinity for social withdrawal. However, there was a gender difference in the way aggression affected the affinity for social withdrawal. Discussion. For male students, expressing anger as an effective method decreased the affinity for social withdrawal. For female students, perceiving her own aggression in a projected form of others' hostility toward her reduced the affinity for social withdrawal. This means that female students express aggression in a more passive way, and fit may be due to the influence of gender role expectancy. Okay. Limitation. From the standpoint of distinguishing between constructive and destructive aggression, it is necessary to examine the content of aggression that reduce the affinity for social withdrawal in our research. In our research, aggression was treated as one factor, but we have to separately test both aggression, positive and negative. This is future research is needed. Thank you for your listening. This is my presentation. If you have any question, please do not hesitate to contact us. There is my email address. Please ask me any question. I'm looking forward to hearing from you, and I hope seeing you next year in St. Petersburg. Thank you.